Take a closer look at what this 11th hour deal might mean for all the other lawsuits in the pipeline. For that, I'm joined by Kimberly Leonard. She's a senior healthcare writer for the Washington Examiner. Thank you for joining us.
Thanks for having me.
So this landmark federal case would have been the first trial of its kind against the big pharma when it comes to opioids. Talk about the importance, not just of this settlement, but really why the stakes are so high.
Well, we really thought up until really the last minute that this case was going to be in federal court, and whatever was going to be decided was sort of going to be the guide for whatever all the other counties were going to do. There are over 2,500 counties that have sued, and cities and states for the opioid crisis, and they're trying to reach some kind of a deal because they would rather that this case not make it to court, where a lot of their tactics of pharmaceutical companies would be laid bare for the public.
So then we know that 4 of the parties are still being encouraged to work on a broader deal. What can we expect from that?
Well, it could really come at any time. We know that there was a deal that crumbled over the weekend that would have had these different companies pay out $48 billion. And that sounds like a lot of money, but it would have been paid out over 18 years. A lot of communities across the country are saying that's way too much time. We're in a crisis now, and we need to deal with this now.
So then by essentially settling then, will we ever really know exactly what the pharmaceutical companies were doing with this?
Well, only if they end up settling. If not, if some of these cases make it to trial, let's say, a couple of them do, then we could find out more of the tactics. There are also other ways that journalists could, unseal certain documents down the line, or be able to see, some of the ways that companies perhaps manufactured and distributed the products in ways that were unsafe for the public.
Now let's talk about the face of the opioid crisis itself. Which demographics tend to find themselves really being at the center of this?
Well, those who've gotten the most attention have been rural white Americans, but really it has hit every single demographic in this country. And it has hit, rich people, poor people, people of all different races. And that's why, one of the reasons why it's gotten so much attention, because so many people have died. Deaths have hit about 50,000 people a year. It really has hit a toll on every single community across the country, and that's why you have presidential candidates paying attention, that's why you have the Trump administration paying attention, and members of Congress who have passed various bills to help get a handle on this very complex, difficult problem.
That was interesting because there's been a lot of criticism in terms of the comparisons between how the opioid crisis was handled sort of with treatment versus what we saw with the crack epidemic, when it was really more of a police involvement, more about law and order. So in terms of how this has been characterized and the treatment options and the consequences, what's your take on that comparison?
Right, well, it's really interesting because had the crack cocaine epidemic been treated more like a disease of addiction rather than, a moral failing or one that deserved a war on drugs approach, then we might have laid the groundwork for the current opioid crisis that we currently have. There are a few differences between the drugs. Cocaine addiction makes you have more of a high and creates, a little bit different kind of a reaction than, an opioid crisis where people tend to, fall asleep, and it's more of a depressant. And so the way that, the police interact with people who are going through these addictions can be different. We also know that the opioid crisis has medical solutions. People are able to take drugs that help stave off the pangs of addiction. We don't have that for crack cocaine, but it certainly is probably an impetus to start doing more research about ways that, people could stave off some of these withdrawal symptoms.
And just very quickly, we know that there are defendants essentially throughout the supply chain from production to distribution, and not just nationally, internationally as well. What do we know about the role of international elements in this?
Well, we know that the Trump administration has been working with China specifically to be able to keep fentanyl, which is a very strong opioid, and it's illicit fentanyl. It's about 50 times stronger than heroin. Just like a teeny salt shake into the palm is enough to kill the average person. So it's a very strong drug. We know that it's coming from China through the mail, and that people are often using these drugs. Sometimes they are using heroin and they don't know that fentanyl has been added and they overdose, or they're using a completely different drug like cocaine and fentanyl has been added. So there's been an effort to really stave that off, but if it's coming through the mail and it's very small traces, that's a very difficult thing to do.
And we know that China has made efforts on that, but obviously an ongoing problem. Thank you so much for your time. Kimberly Leonard there, healthcare reporter for the Washington Examiner.